President Trump's executive order on Make America Healthy Again has raised questions amongst people across our neighborhoods. I'm your Holt neighborhood reporter, Sarah Polis, sitting down with a mother who brought this to my attention and hearing what a local psychiatrist has to say.
I don't know of any parent that has put their child on medication without trying all the other alternative measures first.
I met neighbor Rebecca Kaysen when I was out on a previous story. She wanted to talk to me about an executive order from President Trump on making America healthy again. She was concerned about what the order could mean for her daughter Leia, who struggles with social anxiety.
If we were to take away her medication today, there would be no more karate. There would be no more being a leader at school.
The executive order on making America healthy again states in part that President Trump wants a report that looks at the prevalence of and threat posed by the prescription of SSRIs, which are a group of antidepressants. The order has neighbors like Kaysen concerned for the future of her daughter Leia, who takes an SSRI called Lexapro.
Medication is there when all of that stuff is not enough.
With the executive order, her worry is that her daughter would no longer have access to the medicine. I listened to Kaysen's concerns and then went to get the perspective of a psychiatrist in my neighborhood. I spoke with Dr. Farha Abbasi at McLaren, who tells me she's all for helping improve neighbors' health, but believes medication is not a threat.
And what we know, especially in youth and children, if they are depressed and if you're not providing them clinical support, they turn towards alcohol, marijuana, other street drugs.
Abbasi says she's worried for what this executive order could mean, especially for children.
As a provider, am I concerned? I'm definitely concerned.
I wanted to know if medication like this could actually be taken off the market by the administration, so I contacted the FDA several times over the last few weeks, but I didn't hear back. I still wanted to know whether losing access to the medicine is even a possibility, so I reached out to a professor who specializes in the law surrounding the FDA.
And this new administration is casting things in terms of, well, there's this hunger, I'll put it that way, for an evaluation of these drugs, and that's exactly what we will be doing.
Anna Santos Rushman teaches at Villanova University. She tells me that these drugs could be taken away, but there is a specific process.
There is a process for FDA to remove things from the market, but only if there is scientific data suggesting that a drug is not safe or effective.
For now, the Kaysens are hoping SSRIs don't go away. As they tell me without it, Leia wouldn't be where she is now.
Leia's in general ed with no supports at the moment. That was not a reality a year ago.
In Holt, Sarah Polis, Fox 47 News.